Good day, ma'am. This is Lanoy Matunilio and this is my performance. Nearly all movement in the body is the result of muscle contraction. Muscles attached to bones or internal organs and blood vessels are responsible for movement. In the human muscular system, skeletal muscles are connected to the skeleton, either to bone or to connective tissues, such as ligaments. These muscles' predominant function is for contractibility. There are about 600 muscles in the human body. The three main types include skeletal, smooth, and cardiac. Now, for today's task is to identify 20 significant muscles in the human body and provide its function in movement and support. Starting with occipitofrontalis. It is a long and wide muscle of the scalp, spanning from the eyebrows to the superior knuckle lines of occipital bones. This muscle moves the scalp forwards, and the frontalis part lifts the eyebrows and moves the anterior scalp backward. When the frontalis muscle contracts, the vertical fibers pull the skin of the eyebrows upward. Next in line is temporoparietalis. It attaches to the coronoid process and anterior ramus of the mandible. The action of this muscle is upon the mandible and results in elevation for jaw closure and also causes retraction of the jaw and to fix the galeal aponeurosis. Along with these muscles, we have orbicularis oris. It comes along with the buccinitor and pararygenial constrictor from the functional unit, commonly known as buccinitor or buccinitor mechanism. Its important role is for orofacial function such as swallowing, sucking, whistling, chewing, vowel pronunciation, and kissing. Besides, there is also orbicularis oculi, a muscle located in the eyelids. It is a sphincter muscle arranged in concentric bands around the upper and lower eyelids. The main function is to close the eyelids that occurs when muscle contracts. Additionally, there is a muscle that helps you move your arms in different directions called deltoideus. It protects and stabilizes your shoulder joint. Hence, its primary function is for extension, external rotation, and horizontal abduction. In stretching this muscle, reverse the action by internal rotation, flexion, and horizontal adduction shoulder joint. Now, we have trapezoius. This muscle works in tandem with serratus to coordinate rotation and movement of the scapula to accommodate the full range of motion of the arm. Specifically, they facilitate abduction of the arm from 90 degrees and farther upwards. The pectoralis major, colloquially referred to as PEX, pectoral muscle or chest muscle because it is the largest and most superficial muscle in the chest area. This muscle helps you move your shoulder. It also helps pull your arm across the front of your body. Functionally, there we have latissimus dorsi. This muscle belongs to the muscles of the scapular motion. The muscle is able to pull the inferior angle of the scapula in various directions, producing movements on the shoulder joint. Furthermore, in the arm, we have triceps brachii, a large, thick muscle in the dorsal part of the upper arm. It often appears in the shape of a horseshoe on the posterior aspect of the arm. The main function of this muscle is extension of the forearm at the elbow joint. Additionally, its long head contributes to the extension and adduction of the arm at the shoulder joint. On the other hand, biceps brachii function its proximal tendons in the shoulder for stabilization, assistance in the arm abduction, and flexion and internal rotation. It also acts as a flexor and as a supinator, especially at 90 degrees elbow flexion. Then we have serratus anterior, responsible for the anterolateral motion of the scapula, which allows for arm elevation. When the shoulder girdle is fixed, all three parts of the serratus anterior muscle work together to lift the ribs, assisting with respiration. Rectus abdominis. This functions to move the body between the rib cage and the pelvis. The main actions for this muscle are flexion and thrust. Flexion of the thoracic and lumbar spine, while it works by drawing pubic symphysis and sternum toward each other. There we have also rectus femoris. It is a biarticulate muscle, meaning it passes over two joints, the knee and the hip. Its main function is as a knee extender. However, the proximal attachment at the anterior-inferior iliac spine and the acetabulum allows for this muscle to act as a hip flexor as well. Collectively, gluteus maximus. It helps in the conjunction with other gluteal muscles. This is to stabilize the hip by counteracting gravity's hip adduction torque and maintain proper leg alignment by eccentrically controlling adduction and internal rotation of the thigh. We have also muscles called flexor retinaculum. It forms a retinacular bridge over the carpal tunnel, extending from ulnar to radial direction. Its main function is to protect the contained without a significant mechanical action in supporting the transverse carpal arc. Also in line is flexor digitorum. As a superficialis flexes the medial phalanges of the medial four digits at the proximal interphalangeal joints. It also flexes the proximal phalanges at the metacarpophalangeal joints and the wrist joint. It also flexes the finger it serves independently. Also, sartorius. Actually, it does not have a primary action. However, it helps with a variety of secondary actions. For example, knee flexion and medial rotation such as hip flexion, abduction, lateral rotation, and thigh flexion. Next, we have quadriceps femoris. This muscle is to extend the leg at the knee joint and to flex the thigh at the hip joint. They also help stabilize the knee by holding the patella inside the groove in the femur or thigh bone. Primarily active in jumping, running, and kicking movements. We have soleus. This is to create plantar flexion, pointing the foot down. It serves a particular important role in standing, walking, and running. If not for fatigue-resistant pull, it would be far more challenging to maintain a clean, upright standing posture. Finally, last in the list is triceps surae. It is not responsible for the generation of propulsive force, but is merely supporting the body during walking and restraining it from falling. By controlling the disequilibrium torque, however, triceps can affect the propulsive force through the exchange of potential into kinetic energy. Now, these muscles in the muscular system is composed of specialized cells called muscle fibers. Through this, in collaboration with the other systems, particularly the skeletal system, it enables us humans to move since their primary function is for human movement. Thank you and God bless.